My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are pleased to introduce Kelly McDevitt, who is the president of Integrated Benefits Institute, aka IBI.
Hey, Norm. How you doing?
Hey, Kelly. Everything's going well. How are you?
Good. Can't complain. Sunny day in North Carolina.
Excellent. Yeah, it's shockingly sunny in Cleveland. I still think it's in the 20s, but at least we're getting sun, so that's good. So just want to give anyone who's viewing or listening a little bit of background on Kelly. So, Kelly is the president of IBI. Actually, this spring coming up in 2024, she will be retiring. So, Kelly, congrats on retirement. I believe your successor has been announced.
Yes, it is Jim Huffman, formerly of Bank of America and Fidelity and Willis Towers Watson and others. Many of you.
I'm assuming you two knew each other pretty well.
Yes. Jim was actually my client back in the day.
Love that. That's incredible. It's great to be able to work with folks that you've worked with for a long time. So in addition, Kelly served as the National VP of Enterprise Strategic Accounts at UnitedHealthcare, also leading the Center for Advanced Analytics, a specialized analytics team focused on research and innovation. At UHC, she also led collaborative ventures group that partnered with employer coalitions such as the Health Action Council, Equity Healthcare, Employers Health, and Berkshire Hathaway.
Yep.
And prior to her time at UHC, Kelly was at Etna for over 2 decades. So can't wait to dive in and hear about all your amazing experience in this health and benefits world. So first question I'd ask, Kelly, you've been, in health and benefits, if not most of your career, your whole career. What brought you into, healthcare out of school?
It wasn't my life's dream. I can tell you that right now. I never woke up and said, hey, I want to do benefits and be in the insurance industry someday. Woohoo! I really fell into it, honestly. And, I was so young. I had a friend who worked at Aetna, and she worked a part-time job with me, if you can believe it or not, at the children's photography studio in the mall. Remember you probably don't remember, Norm, you're too young, but in the middle of the mall, there's like a kiosk where you could go take your kids for pictures. So we worked there part-time at night, and she's like, I work at Etna during the day. They have benefits. And I'm like, what's benefits? Why do I need benefits? And she's like, it's Monday through Friday. You don't work weekends. You don't work nights, and they give you benefits. And I was like, okay, sure, I'll try it. So, went to the Reading claim office and took my little test on processing claims. They test how fast you can do it, and got the job. And, that was 40 years ago in November.
Wow, glamorous way to start in the industry,
cool.
Processing claims, everyone's dream job. So walk me through those 30 years at Aetna, almost God. 30 years. I know there's a lot of content in there, but, what was it like, through the early years, through, at the end when you held a huge, position and a lot of responsibility?
Yeah. When I first started, and honestly, this is one of the problems in the industry today. There's not a lot of people that were brought up through the industry. Mm-hmm. And so, you don't get as exposed to every job as you used to in the old days. I hate to call it the old days, but it really is. But, starting out as a claims processor, and then I became a customer service rep, and, I'm on the phone with members every day, talking to them about their problems. Then I ran a call center and claims center. And then when the Aetna US healthcare merger happened, they asked me to be a salesperson. And I was like, a salesperson? I don't know how to sell things. I know how to run a claim shop. You know what I mean? But honestly, that was the beginning of my career, really. But throughout my career at Aetna, they're very good at this. They're still good at this. They kind of cross-train you on things. And so, I worked in the home office. You have to do your home office stint. That was kind of part of the job back then. I built systems for customer service people, which I knew nothing about computers or how to do that, but I was the business person on that type of a project. And then when I became a salesperson, I just happened to be already working on what became Verizon, the old Bell Atlantic 9X merger.
Mm-hmm.
And because I worked on a super jumbo client, I got a lot of exposure to other super jumbo clients. And that really became my book of business throughout my career. So, getting into account management then and sales, really started to manage teams of people who manage those accounts. But it gave me exposure to some of the industry leaders and thought leaders, and to work on challenges and issues that those clients have. Not that it's any different than the smaller clients, it's just on a much bigger scale. And what's cool about it is it allows you, to take that force to market. You're working on Walmart and you've got 1 million members. I can tell you that providers and health systems and vendors sit up and listen, right? They're
Yes.
like, I'm sorry, did you say Walmart is interested in this? So
Mm-hmm.
it becomes a different conversation, and it exposes you to some of the bigger thought leaders in the industry.
What does it take to manage, a large Fortune 100 account when you're working for a carrier? Like, what goes into that? What are keys to success to anyone who's either doing it or aspires to do it?
Yeah, I think the number one, there's two things that it takes to manage those accounts: courage and patience.
Mm-hmm.
So, courage, you need to go back into your organization and create change. Um, Large companies aren't super nimble or flexible.
Mm-hmm.
And so, when I remember UPS wanting to do a lot of really innovative things in the market and coming to me and saying, can we do this? Can we do this? Can we do this? And me kind of banging my head against the wall, going back into the organization and saying, we got to build this. We got to build this. And it taking sometimes years to accomplish
Mm-hmm.
that. So you really have to have a lot of patience. And you have to be willing to push the boundaries. I was never known as someone who would take no for an answer within my
Mm-hmm.
organization. I was a little bit of a rabble rouser. And so, but you have to be willing to do that. You have to be willing to fight for your client, to get them what they need and want. And what happens then, and I don't know that this organically happens anymore in the industry, but it creates a relationship with your client that you don't always give them the best or the right answers that they want to hear, but they respect the fact because they know you fought for them. So
Mm-hmm.
I had a loving nickname from one of my clients. They would call me the bulldog because they
Mm-hmm.
knew I fought for them and they appreciated that. And not that I always got the right answer, but that I was willing to go to bat.
It's fantastic. I think what's unique about the carriers is they have these huge customers, but they themselves might have more employees than most of their biggest customers.
They do.
So how often, in your 20 plus years, did you bubble something up saying, hey, this is working really well for one of our bigger clients? Have we tried this for our own employees? And like, how often did that happen?
Yeah, it's funny. It happens in reverse. At least it did at both Aetna and United.
Mm-hmm.
Both companies, I would say one of the really good things about both of those companies is they eat their own dog food before they sell it, right? So
That's good.
when we would build something at both Aetna and United, we tried it on our own population first, always,
Mm-hmm.
without fail. We never rolled out anything that we didn't first test with our own population. And, there were things certainly at United with Optum bolted on because Optum is really the, thought creation, partner in that relationship. They're huge on trying everything out on your own population, and there are so many startups that come through that organization as a result. Not all of them make it, and not all those ideas make it to market. And that's the right way to test the market, I think, on your own people.
Yeah, that's fantastic. And that's why all these vendors, just strive for and dream of having ASO partnerships with their biggest health plans. And if, those health plans have amazing credibility because a lot of the times they try these solutions before, they share it with their big customers. I think, that's why those could be so lucrative, for a digital health company that's got a great solution that wants to commercialize and scale it quickly.
You bet. You bet. It's the dream.
Yeah. What was some of the things you're most proud of from your time at Etna?
Um, well, first I'll say, Aetna was back then a fantastic company to work for. It was very cradle to grave, family oriented. If you
Hmm.
started at Aetna as a young person, went through Aetna Group School, learned how to be a really good salesperson, you could pretty much count on a career, and really a lifelong career out of it. And it made you feel like you were part of something much bigger. That kind of waned away over the years, probably after 25 years there.
Hmm.
But what I'm proudest of is that process of learning all of those jobs and all of those functions within the company, which then created stickiness and relationship with all of my clients. Like I said, not every client is happy with everything I ever told them, but I always had trust with my clients that I would give them the true and right answer, whether it was what they wanted to hear or not. I will say that what Etna taught me was that relationship building is at the center of every sale, and
Hmm.
there's nothing you can build with a client outside of trust that will get you more business like a relationship will. And Etna taught us how to do that. Etna supported us in building that stickiness so that you could continue with that client for many, many years. And some of my clients, I was on their accounts for 10 and 15 years.
Yeah, no, I think that is ultimately what you described as consultative relationships. Ultimately, you can have the tougher conversation at the beginning and save your client a lot of headache at the end, or just shake your head, say yes, 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 and then a huge issue occurs later that's avoidable. Um, and they like you until that very point, and then they're very angry at you.
Yeah. Well,
So I think that's like a really, really
Well,
good thing.
and to your earlier point, that's the problem with working in a very large matrixed company. I can't control, whether their ID cards get out on time. That's just
Yeah.
something that has nothing to do with me. But I'm responsible for making sure that that happens correctly within the organization. And they knew that.
Mhm.
And so while you can't take responsibility for everything, you can certainly own up and be the whipping post sometimes when you need to.
Yep. What were your greatest challenges and learning experiences from your time at Etna?
Um, I think my greatest challenge was personally, I probably would have stayed at Aetna until I retired completely. Like it would have been my lifelong career. But, after quite a few leadership changes there, I just saw that sort of family dynamic where you knew where you stood in the company and that you felt like you had had made a contribution to your clients, and you could see where that happened. I lost that at some point, and not that Aetna did it differently than anyone else. I think sometimes that just happens when
Hmm.
leadership changes happen and enormous growth happens within a company. And so you just kind of lose that within the organization. And I didn't feel connected to the company the way I had before. So that was probably my biggest challenge and just
Hmm.
really disappointment because I had no plans of ever leaving that company. But I will say, when I went over to United, I was happy to feel that again.
Hmm.
The part of the organization, the enterprise strategic accounts, which is the largest clients in the book,
Yep.
that team just felt like a wonderful family again. So it was awesome that I moved back into that environment. It felt good.
All right. Your last handful of years at Etna and your first couple years at UHC, those were very early times of digital health. That's when a lot of these vendors started popping up and coming out of the woodwork. So just like take us back to mid 2000s, like the very earliest companies that kind of disrupted the market to what you see now. And just, what were your impressions initially? Did you think these ideas would achieve as much success as they have? What is done better than you thought? What is more disappointing that you thought would do better that just hasn't been able to achieve what you thought they were capable of?
Yeah, it's funny. You could talk to me in a year and I'll have completely different answers because, as you know, this business is so cyclical.
It does.
Some of the early like Teladoc. I thought Teladoc was like the best thing since sliced bread, right? We knew that one of our biggest problems in the industry was getting to people in care deserts, right? And we didn't even call them care deserts back then. We didn't have those words. But we knew that the people in very rural areas were not getting care in the same manner as people in urban areas were. And we had to do something about it. And I remember having a conversation with Bob Erie at Lowe's Home Improvement, and Bob's like, you know what? I can't wait for this to happen anymore. I'm just going to build giant RVs and drive them to my people and let them get their primary care, right? Which was brilliant and expensive, but worked. And then all of a sudden we get solutions, digital solutions like Teladoc, and we're like, holy moly, they can just do this on the phone. They can, and back then it was truly on the phone, right?
Yeah.
You were FaceTiming, you were just calling someone. And for us, it was like one of those first aha, people might be willing to do this. Now, the adoption rate was not good the first, I don't know, 3 or 4 years.
Yeah.
And we weren't reaching the people we wanted to reach. But now, full circle, 24 years later, we're now looking at 1 million digital solutions for the people who live in care deserts, et cetera. But we're still struggling with our target audience, right? So we did a paper here a year and a half ago, 2 years now, on telehealth. When the pandemic happened, it exploded. Everyone we had no choice. You couldn't go into your doctor's office, had to use some sort of digital solution. But what we found was they weren't using the big national vendors. They were using their own doctors because every doctor in America stood up a digital solution, right? So when we look at that and we looked at the problem we were solving for, which was originally convenience, a lower copay, and getting to the people in the rural areas, we're solving for those problems, right? So we went, So what else could we do with this type of solution? And we, now we pivot to digital PCP care, right? So now we're going there. So for me, it's this whole evolution of point in time. Right now, today, we know we need digital solutions for pockets of people, pockets of kinds of people who want to use those types of solutions. It's a whole different ballgame than it was in early 2000. Early 2000, some of those digital solutions were first to market and just mind blowing because we just had not considered that people would talk to their doctor on the phone, and that was it.
Yep. Crazy how far we've come.
I know.
In that time. So walk me through, you made the move, to United, you mentioned like the culture was just fantastic upon coming in, and, specifically on your team. Walk me through growth you experienced leading, the Center of Advanced Analytics. And
okay, that was a whole different opener.
Innovation and research.
Yeah. So, many people know Craig Kurzweil and his team. He runs the Center for Advanced Analytics at United and really does all the analytics for the big U. So UHCG, including United, Optum, everybody, right? So, which is a huge undertaking. And I have always been a bit of a data geek, which usually doesn't go together with a salesperson, but I've always really been an evangelist for employers making good decisions based on their data, right? And just don't go off the reservation here with I have a problem I need to solve for, but I haven't really verified that through the data. So when we talked about me taking over this group, first of all, Craig leads this group himself, but just giving him direction and really sharing amongst the clients that are in this group, because this is UnitedHealthcare's largest 20 clients, say 40 clients now. They have a different expectation when it comes to data production, and getting into the tool that United uses for that and how that tool works and what types of data we can feed in really set me on this path that I'm still on today, chasing the Holy Grail. And the Holy Grail for me, for my clients, is to be able to bring together all of their data. And when I say all of their data, I don't just mean medical, pharmacy, and behavioral health. I mean well-being and social media and HRQs and STD and LTD and FML and workers' comp all in one place, and to be able to relate that to their own internal business measures. So that team, Craig and his team, created for one of my clients, it was Delta Airlines, a study requested by their CFO on how the money he spends on healthcare relates to the outcomes that those employees produce at work. So, if you ask Delta Airlines what's important to them, they're going to say baggage handling and reservation accuracy and on-time departures for their planes and customer satisfaction. How can I relate the very large number of dollars that we spend every year on the health plan back to my business results? And really, that's the Holy Grail. And that team at United took that on, and it was onerous and hard, and it is not an easy process. The Holy Grail never is.
Doesn't sound it.
It is not, but we did it, and it, of course, gave the results as you would expect. But we were able to duplicate that for many other clients down the road, and really creating that kind of an analysis, an ongoing longitudinal study of a continuously enrolled population in many different products and programs. It was a lot, but it was well worth it. And it was something that we were really proud of.
Yeah, Delta's invested a lot in digital health solutions. I've seen a lot of companies have them as like a big logo account. So, it's very obvious they care for their employees.
No doubt. They're another cradle to grave company where people, go, stay, and feel a lot of allegiance and gratitude towards their employer.
Yeah, I have a friend that literally will fly connecting flights through Delta as opposed to direct anywhere else. So I think that's wild, but
listen,
oh well.
they are evangelists about that.
Some people's loyalty does, really, really mean something. And that's one of them. This is going to be a very stupid question, but I have to ask. I've always wondered, I'm sure some of our listeners and viewers wonder, what is the difference between UHC and UHG?
Okay. So it's not a stupid question. People ask it all the time. So
I should know this.
UnitedHealth Group is the parent company of all of the subsidiaries of both Optum and United. So you have UHG up here, parent company. Then you have UHC, UnitedHealthcare, which is the commercial health plan. And then you have Optum over here, which is really, I would call the sort of think tank behind the big U and United. And it includes all the real innovation, all the clinical programs, of course, all the new medical relationships that they now own through Optum Care, because they've obviously been doing a lot of buying up of physician practices and groups, et cetera. And then part of UnitedHealthcare also has the subsidiary called UMR, which is the TPA behind the big United. So that UHG is just the parent company.
All right, that cleared it up. I've just been using them interchangeably, and no one's ever called me
No, they're
out
not
on it
really
yet.
the same.
Yeah. All right. Fair enough. So walk us through any innovations you were very hands-on with at UHC that, maybe the listeners would have heard of before, or, just bringing some notoriety to some groups that you thought did, a great job.
Yeah, UHC doesn't really create companies, Optum does. So there were just so many things that I was involved in. But I will say, and I think this is still true today, even though things have changed drastically, the work that Optum does through Optum Care in the purchasing of these providers, I know there's, controversy around a health plan owning providers. But when you think about the industry and where we are now, where we are not graduating PCPs out of medical school, and we have shortages in many, many practices, one of the things that employers are most concerned about is getting their people to the right doctor at the right time for the right price, right?
Yep.
This is a problem we've all talked about for 100 years. I think what Optum is attempting to do is to work with providers, and they study this through data, and I mean it's a lot of data, who are really the best in their business. And it's not just low price providers. That is not even one of the key differences that they make part of their network. I think
Yep.
what they look for is super high quality, but really good efficiencies. Doctors who, in this environment, who are able to work in a super efficient manager and manage their business in a super efficient way, that they can see more patients, spend more time with patients, give them more of their attention, be more thorough, produces better health outcomes. And there's a value to that. Yes, you may pay more for the actual office visit or consultation, but your health outcome in the end for those more efficient, high quality providers is really worth something. So some of my clients were very involved in some of the earliest acquisitions that Optum made. Riverside Medical Group is one of them, who was run by a very talented CMO. And working hand in hand to not only acquire the business, that was kind of an afterthought. It was, hey, we found this doctor's practice, a large practice that just has such phenomenal outcomes compared to their peers.
Mm-hmm.
Why is that happening? And really studying the guts of how that works, every little piece of it. And then furthermore, coming in and supporting that process with new tools and technology and any other support that they needed in the office. Really great outcomes. And is it cheap? Nope. Can every carrier do that? Nope.
Yeah.
But when you have the right synergies and the right support to do that kind of work, I don't know. With all the hospitals gobbling up every doctor's practice that's in America, I'm not sure that there's any other solution than doing that.
Yep. Makes ton of sense.
Yeah.
So you did some amazing things at UHC, and then you joined IBI. Kind of walk me through that.
Yeah. So I don't know how I ended up here. I'll tell you. It was never my intent to ever run a nonprofit, which is so weird to me. And certainly never a nonprofit that was really specialized in absence and productivity. I had been to an IBI conference before, loved the work they did. Dr. Tom Perry, who started the business and was the president before me, very, very well respected in the industry, and I just loved him to death. But when I thought about, the name of our company is the Integrated Benefits Institute,
Mm-hmm.
and I kind of linked that to the Holy Grail pursuit that I've always been in and my, employers want. I thought, wait a minute, IBI sits on the only database in the United States that collects all that absence data that everyone is missing, right?
Mm-hmm.
Everybody's missing. They have it. They don't know what to do with it. Maybe they don't have it. They don't know how to get it. And when you think about what happened during the pandemic, employers now are paying very close attention to productivity.
Yes.
That was a word that really wasn't a big word in the past. I'd sit down for a QBR with my largest clients and we'd talk about their medical and their pharmacy, maybe a little bit on their mental health. And we'd say goodbye, have a good day. I didn't even know who the guy was that handled comp or disability or absence. Never got to talk to him, even though we paid those benefits. We didn't really talk about it. And so now that the world woke up and went, oh, productivity is really important, especially now that most of my staff is working at home and I have no idea what they're doing.
Mm-hmm.
Now I have this opportunity to bring the data we have always had at IBI for 26 years to clients. And so I set off, Tom and I really talked about this when I took over. Where do we go from here? And it was my idea that we needed the capability to bring that data together. So we did an RFP. We entered into a relationship with HDMS, who is the data warehouse behind Aetna CVS Health, firewalled database. And we designed a set of, it's a data portal It's called the IBI benchmarking portal, which we already had all the benchmarking for these products, but we put it into a very visually appealing tool where we now have the capability to bring together in phase 2 medical, pharmacy, behavioral, well-being, STD, LTD, FML, workers' comp data in a set of dashboards where a client can watch what's happening in their population across all products and programs. So, for instance, mental health is one that always comes up.
Yes.
Mental health touches every product, right? But the guy that does medical over here and the guy that does pharmacy over here and the guy that does absence over here don't see like the balloon effect where it's not costing me a lot on my medical, so I don't pay attention to it, but my STD claims are blowing up over here. So it will give employers the opportunity to see at a glance how their business is running in a set of dashboards that's easily available to them and is customizable. So that's what I've been working on at IBI for the last 3 years. We launched it in May. We're doing phase 2 next year. Really great relationship. But, we also have a research arm at IBI. We do a lot of PhD level research for the industry that our members vote on every year, what they want us to research. And then we also do events. As you know, we do a conference every year, a big conference in September in Chicago with Conference Board. And then we do regional events throughout the year. So I'm very proud of the work we do as a very small nonprofit. And I still get to play with all my friends in the sandbox.
It's incredible. Really, really great. It obviously makes a benefits manager's life a lot easier when they have, IBI's data to help them make informed decisions. You've mentioned to me when we talked last that it's a free service for the employers. Can you walk us through, why IBI decided to go that route and how it benefits everyone?
Yeah, we're very different in the marketplace. We don't charge employers for membership. Because we firmly believe that these partnerships that they're already paying for. So for instance, if they're, I have 13 very large employers on my board, and they're already working with the Standard or Sun or MMA or Willis Towers Watson or whomever, right? Who are also on my board and members of IBI. They are their vendors. They are their consultants. They are already paying to work with them. To charge the employer another fee just to be a member of IBI, we really believe that work, because we don't consult. We are completely unbiased in the middle entity.
Yep.
So if I look at your data and say you need a stronger mental health return to work program because your mental health STD claims are off the charts and they're longer than anyone else's and they're more expensive than anyone else's, so clearly something's not working in your program. I don't then say to an employer, so go talk to XYZ vendor. That's not my place to do. What I want to do is send them back to Willis Towers Watson or Aon or Mercer or whomever and say, let's sit down and go through this data together because they're the experts. They should be able to help you and you're already paying them. So they should be able to help funnel you back and say, okay, let's start looking and tearing into the data. What's working, what's not, etc. So we really believe that the vendors, when I say vendors, I have pharma paying, I have all the carriers, I have all the consulting firms, etc. Those are the vendors who pay me for membership.
Yep.
If I'm working correctly in collaboration with them, we are all coming together to support that employer point of view. So I don't think I should charge an employer for that.
Very admirable.
It works for us. I know it doesn't work for others, but it works for us.
So let's just pretend my firm decided, hey, we're going self-insured, as opposed to, currently fully insured. What advice would you give me or any company looking to go or go self-insured? Like, what would be the first 3 to 5 moves you'd recommend, for a company that's just starting to think about healthcare holistically?
Get a really, really, really good actuary to be looking at your data. Depending on the size of the company, it's usually smaller clients that grow and then decide to make that move. Most,
Yep.
99% of my large clients are self-insured. Getting under the hood and understanding the need or the cost benefit of you going from fully insured to self-insured is hard.
Mm-hmm.
And the reason it's hard is because your current carrier who fully insures you ain't giving you squat for data. You're not getting, you don't really know what you're going to be on the hook for. But a really, really good actuary or medical economist can help you figure out what's under the hood just by looking at your renewals and what you're paying, et cetera, your capitation, all that good stuff, the little bit of data you can get. And they can also help you understand what you can demand from your current carrier. Even though you're fully insured, there is some data that you do have access and rights to. And many employers that are smaller don't know what they can and push for and get. So I would say, get yourself a consultant that's a really good actuary. And then the next thing is have a really good understanding of what you're wishing for, because becoming self-insured isn't just a financial decision. Mm-hmm. Becoming self-insured, what some employers don't understand is that you are now in charge of every line of benefits that your employees get. And what I mean by that is when you're fully insured, you don't have a whole lot of choices of what you say is covered and not covered. It's built into the plan. You may have one or two decisions on riders and add-ons, buy-ups, but for the most part, you're letting the health plan make those decisions. You're also letting the health plan defend those positions, right? When you become self-insured, it's all on you. You will require a whole new set of administrative tasks and really need for probably employees to support a self-insured plan. That's a lot of admin and it's a lot of responsibility. And are you ready for that culturally as a company? That's a big thing that employers don't really consider, because you're the bottom line now. And when an employee says, we don't cover weight loss drugs, what do you mean we don't cover weight loss drugs? They're not going to the carrier anymore. Mm-hmm. You. And you're going to have to make benefit decisions outside of the plan. So do you have people who are qualified to do that on your team? Many don't. And so ERISA, complications and, rules and requirements, policy rules and requirements. Do you understand what's territorial and extraterritorial in government law and state law and federal law that applies to benefits? Your carrier's been handling all that for you all these years. You make sure you know what you're taking on before you say yes to that.
So you've seen hundreds, if not thousands, of vendors, over your career. I know you can't pick any favorites because you're still part of IBI and completely impartial.
But I can give you my personal opinion, just not my business opinion.
Yeah. I would love to understand, what are some vendors, you think have done really good work, for companies you've seen?
There are so many. So one that, mental health is just so big right now. And we literally just got our survey results back from our members for our 2024 research topics, and mental health is number one, 4 years in a row.
Yep.
But how many ways can you look at it anymore? I mean, over the past 36 months, we've looked at mental health 65 different ways from Sunday. Yep. And what's funny is the same issues remain as we're here pre-pandemic. We still haven't solved them. So now I'm really looking at vendors who are looking to solve specific issues within their genre. And mental health is probably a really big one. So I will say, I know this isn't a popular thought right now, but I think a lot of employers, I know a lot of employers, because they tell me, are dealing with an overwhelming number of vendors. So they're looking at consolidation. They're all looking at consolidation. So when you think about the mental health space, how many mental health vendors can do it all? And there aren't that many. And I will say Magellan is one that I've been working with for 40 years, and they can do it all. It's just so rare that there's one big vendor that offers every product and program you could possibly want, from digital all the way through to in-person care, very high, rigorous clinical care standards and guidelines, and can plug and play with a carrier, any TPA like that.
Mm-hmm.
Has the biggest network in the United States. I mean, and is doing innovative things in spaces like finding new networks of in-network providers to be able to support the problems we know we still have, right? So
Yep.
I don't know, for a one-stop shopping, super, clinically focused, still moving with the times and agile. I know Magellan's just done a really good job.
Wasn't expecting that one. That's old, reliable, nothing sexy about it. It's Magellan, but hey.
But there
if it
is
works,
sexy
it works.
about it. I think that's where people get lost. They do have new products and they're doing new innovation to solve for today's problems in the mental health space that you wouldn't think old reliable was doing. But they are. They really are innovating, which is cool. And I have to tell you, Norm, old reliable right now sounds pretty good to employers.
Yep.
Mushroom vendors, that pop up every time it rains. There's not a lot of trust there right now in the space for new point solutions that are in an already crowded space.
Yep.
With that said, I will say there are new point solutions in a crowded space that are standing out to me. Terra Mind and Thea are two that are in the psychedelic space right now and really launching clinically sound ketamine quality programs and psychedelics where they just don't exist otherwise. And, employers are just now, I think, starting to realize that their employees are out there using these products on their own, uncontrolled, maybe buying it on the street, maybe not even getting it through a clinician. God forbid, I heard somebody tell me the other day that they were getting ketamine through their chiropractor. I'm like, is that practicing within a license?
I went to the chiropractor this morning. That wasn't offered.
Yeah, so I wouldn't go there, right? Apologize for the dog. People getting these things anyway, that there has to be a solution. And these diagnoses that they're treating are in every population. Treatment-resistant depression is a problem for everyone. And those two vendors in particular come from CEOs with their own personal stories about why they created a company like this. But I think what's even more impressive is their clinical beef. Like they're not, this isn't fly by night. This is looking at data and studying the data and having the outcomes data to present to clients that is pretty impressive. So those two in particular just come to mind as new ones that have surfaced in the last 12 months that are, I think, filling a needed gap.
A lot of people that watch this and listen to this are from the vendor world, whether they're founders of companies, salespeople, marketing people, customer success folks, product, you name it. Those types of folks watch this. So if you were giving advice to a founder that is got a new point solution, doesn't really exist in the market yet, for the problem they're solving, and they're going in to pitch a benefits leader, any advice, you would give to them, just knowing how much those people are inundated?
Yeah. Getting an invitation to the dance is hard. I will tell you that one of the biggest complaints that I have always had, and Jim Upton was one of the first people that said it to me way back in the day from employers, is there's a lot of innovation going out in the market that I probably don't know about. And maybe I do need to know about it. Maybe I don't. But I can't meet with 29 vendors for 29 hours to figure out that one of them maybe has a good story.
Yep.
So I would say that your invitation to the dance, think of other ways to get it. Sending emails to the CHRO at Bank of America is probably not going to get you an invitation.
Yep.
So presenting in forums where startups shine, at both Conference Board Healthcare Conference and at my conference in September, we do a market showcase that is just startups. it is a way we're trying to solve both ends problems, right? So employers can sit down and see 15 vendors in an hour, really get their sort of elevator pitch and understand this problem that they're trying to solve for, and can then relate back to, hey, that's one of my problems. I need to start talking about this. And for the vendor, it's immediate live feedback on that didn't work. Your elevator speech for me just didn't come across, right? And giving you live feedback on what works and what doesn't. So I would say don't do the cold call thing. It never works. Get yourself to a place where employers gather, right? Make the investment, whether you're going to BGH or MBGH or wherever, to get that conversation with an employer, either face to face or at least on a Zoom call. And when you present, you better have 3 things ready immediately. Don't talk about your VOI anymore. VOI ain't selling. What is your direct impact to employees? It may not be a big ROI. Not every employer is looking for a big ROI. But if I pay you $1.50 PEPM, which probably shouldn't even be a starter, forget PEPM. If I'm paying you $1.50 per participant, not per employee, I just need to know how that's coming back to me. If it's in a clinical outcome 5 years from now, then say that. Don't go the cost avoidance model for savings for ROI. I think those days are over. I think you need to have a personal message to solve a problem that they're trying to solve for. If you go into a manufacturing firm and try to sell women's health benefits to an 85% male between the age of 50 and 60, it ain't gonna fly. Know your audience, do your homework, make sure that you're solving a problem they actually could have. And then the last thing I will say is, if there is, where I see these vendors winning, when I heard Marcus Capone tell his story about Terra Mind, I immediately sat up and listened. He is not only solving this for others, he had to solve it for himself. That makes a huge difference. Same thing with products and programs we've developed at Optum. If someone who develops a special needs program has a child that has special needs, lived it, knows the system, knows how to get through the system and why it should work the way he's saying it's going to work. Whole different story, whole different meaning. Not everybody can do that. Not everybody has that kind of story. I have to know in the first minute what problem you're solving for me and why I should care about it.
Great advice. Would you give any different advice if they were going to talk to a broker and consultant versus the employer directly?
Yes.
And what's different?
Well, I have to say, if you've seen one broker and consultant, you've seen one broker. I won't say that about the consulting firms, but every broker approaches their book of business very differently. You might have the shark cold call sales guy who does really well because he knocks on 1,000 doors in a day, right? For that person, I would sell completely differently. It would be all about your commissions and what you're going to earn on getting me this product out on the street. For the really good consultant partner with employers, you're going to do it exactly like you would have to the employer, because that consultant only wants to do the good job and solve the challenges for their employers, right? So I would approach it. This is how I always approach everything. Listen, Mr. Consultant, I'm going to make you the hero. Your client, XYZ company, has been struggling with women's health benefits forever. It's a huge female population. All they care about is fertility. They're young, blah, blah, blah. Adoption, leave, etc. I have the solution for that. I can help quiet the noise around this. I can improve attraction and retention by X. I can keep them on the job by having these caregiving benefits for them when they have their small children, blah, blah, blah. I'm now making that consultant a hero to their employer who's been trying to solve for this forever. That has always been my approach, is let me help you be famous.
I like that. Really good. any advice to these vendors? We mentioned it's like the holy grail for them when they can get a health plan to sell their ASO clients. Any advice on like how to make it easiest for a health plan to say, yes, we will start doing that for you?
Yeah. For a health plan, this is all about ease of administration. I'm not even taking a meeting with somebody who can't plug and play with me. If I sit down with a vendor who says, the first thing I ask them is, how are you going to get me your data and how often can you get me your data? And they say, well, we haven't quite figured that out yet. And I think I could send it to you annually. Bye.
Mm-hmm.
If you can't plug and play with me and you have to walk in the door, especially if it's a big health plan, even some of the big TPAs, you better already know that they use a 2,000 byte layout. You better know that they accept hourly, daily, monthly, weekly feeds.
Mm-hmm.
You better know how they've plugged and played with your biggest competitor. If I'm going in there and I'm selling a diabetes product and I know that they already plug and play with Livongo, I better have a solution that does at least what they do.
Yeah.
Right? So you have to knock out the table stakes and then get to the conversation about what your value prop is. Because that's not a value prop. If you think that coming there and saying, I can send you data every month is your value prop, it's not. You've got to knock that checklist off before you ever start your conversation about what makes you different.
A lot of people will eagerly listen to that part, no doubt. I ask everyone who's on this podcast, like, how do we all practice what we preach? We've been in healthcare all these years. How do we, do it ourselves? So ultimately, from yourself, like, how do you participate in wellness? Like, what do you do to exercise? What do you do to reduce stress in a very high stress job?
Well, I will say pre-pandemic, I was in the gym 4 or 5 days a week and haven't been like that my whole life. I've been lucky not to have to deal with that until I got a little older. But once the pandemic hit, I went off my routine heavily, right?
Mm-hmm.
And I learned from that, just the pandemic in and of itself has changed almost everything about my life. It's part of the reason why I'm retiring. The things I learned about myself and my family and the world during the pandemic just changed the way I thought about priorities. And so for me, for the first time in my life, I'm a caregiver in my personal role.
Mm-hmm.
And I always take care of others before I take care of myself. What this whole experience has taught me and going into retirement is that I do actually have the right to take care of myself and I have a responsibility to take care of myself. So now for me, I am a huge calm evangelist. That's another vendor that I really, really like, by the way, for employers. For me, it works. Meditating every day before I get out of bed. I don't even get out of bed. I meditate first thing in the morning every day. I meditate before I go to bed every night. I do sleep stories to help me sleep. I've changed completely 100% my sleep schedule. Sleep is very important to me now. I used to get 4 hours a night and think that was like, cool, I got 4 hours, woohoo. I always get 8 hours or more now. And it has made a huge difference in my life. And, the whole idea of limiting alcohol, limiting bad things I eat. I walk 4 times a week, 4 miles a day. And it has created like this basis for me to enjoy the rest of my life.
Mm-hmm.
So like we talked about with the vendors with table stakes, for me, sleep and eating and getting some exercise and being outdoors specifically, that's my table stakes. That has to happen every day. And then the rest of the stuff kind of comes naturally, right? I don't know. That's my philosophy. I don't know if it works for everybody, but it works for me.
I'm going to try it. I don't meditate as often as I would like, but that's a really good idea. Like you don't get out of bed or you don't go to sleep without it. And then it's like, okay, when you're doing it. It's structured.
6 weeks. Yes. 6 weeks to create a habit. It probably didn't take me that long, but because they offer, there's a Jay Shetty does a daily meditation every morning. It's 7 minutes. And there's a daily meditation with another guy on the app that's 8 or 9 minutes. So, you're just 15 minutes of your day to get you started. It just has made an incredible difference for me. It kind of sets my mood for the day. If I don't do it by mistake, if I'm traveling or something, I feel like I forgot something the whole day. It's weird.
Every person that usually struggles with their health always are like, well, like, I don't know what to eat. I don't know, what's quick and what's easy. And it's just easier for me to eat frozen food or get takeout or whatever. What are some healthy, pretty quick recipes that you make that might inspire someone to try it themselves?
I have to tell you, I love to cook, but I live alone. So it takes some gumption to want to cook for yourself when you're just by yourself.
Yeah.
So I'm a big meal prepper. So Sundays I cook a meat, whatever that meat may be, and I do eat red meat. So I'll do a bunch of fish, a bunch of chicken, a bunch of meat, and then the biggest tray of vegetables that you've ever seen in your life that fits in my oven, and whatever's fresh at the grocery store that week. I'll do butternut squash and mushrooms and Brussels sprouts and asparagus and toss it all in olive oil and garlic and some spices and literally it's probably a 3-pound tray of vegetables. And then that I either eat that for breakfast or lunch every day, and then fill in whatever the other meal is. I intermittent fast, so I don't eat breakfast, but for lunch or dinner, rather, I should say. I use the vegetables, but and then I DoorDash the other meal or whatever, and it's usually salad, soups, whatever. But I like to cook and have the food on hand because then I have no excuse to order something bad. It's sitting right there in my refrigerator. It's already made. There's no excuse for me to, get on the McDonald's bandwagon.
Yeah, there's something about cooking that you're like, okay, I spent a lot of time doing it. I'm not letting this go to waste. Then it was a bad use of your time, and then you're more likely to eat it. So once you make it, usually end up eating it as long as you like leftovers.
Yeah. And if you grew up in one of those families where, we never threw food away, that was a sin.
Yeah, my grandma was in the, lived in the Depression, and she kind of ingrained that into her whole family, that it's not acceptable.
Yeah, not acceptable.
So, no, that's great. And then last question, what are you looking forward to doing in retirement starting in, spring of next year?
Well, I don't know. I am equally terrified and excited about retirement. I have never had a break in my life except for when I had my child, and that wasn't a very long break. And so I'm trying to be mindful about not setting really high expectations about what retirement is for me, because I don't know what it's going to be for me. So my number one goal is to spend more time at the beach, and because that is my happy Zen place, and I really enjoy being there.
Which beach in particular?
So I go to Seabrook Island, South Carolina. I have a house there, and it's a very slow community, right? Which is not usually my vibe, but it's good for me, and I like it. And I'm more physical there. I'm more physically active there. So I want to try that, but I don't want to just say I'm going to the beach full time. So I have a volunteer group that I work with here in Charlotte, that I have volunteer work lined up. I am actually already doing 2 part-time jobs for the conference board. I run the conference board's well-being council. And then I am also chairing and running the Be Well conference for conference board next December. So I'm running that conference. So I'll be busy still with people that I'm already working with. And then I'll be president emeritus for IBI. So as we transition Jim in, if there's any help that they need, I'll always be around for consulting for them as well. So I'll keep myself busy, but I do want some chill time at the beach. That's what I'm looking forward to.
You deserve it, but I know all of our listeners and viewers are going to be relieved that you're not completely deserting us.
Yeah, so, I'm not unplugging.
Well, thank you so much, Kelly, for joining us on the Digital Health Heavyweights podcast. Thank you for stepping into the ring with me. Sure. And this was great content. Really appreciate it. Have a very happy holidays. And
you too.
Good luck on your, retirement. Excited to see, how busy you keep yourself.
Yeah, me too. Thanks, Norm. Take care. Happy holidays.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.